Welcome back to TV5 News at 9. Joining us this morning is Dr. Christian Hyde. Thank you so much for being here. How are you, doctor?
I'm doing well, thank you. How are you doing?
I'm doing great. Thank you so much. Well, today we are talking about proton therapy and gynecologic cancers. Now, for people who don't know, doctor, what is proton therapy?
Sure. So proton therapy is a new way of giving radiation treatment. It's less invasive than traditional radiation therapy because the beam doesn't go all the way through the patient. It goes into where we need, and then it stops there.
Okay, very easy to understand. Thank you for that. Now, what are the gynecologic cancers that proton therapy might be best to treat?
Sure. So there's two main GYN cancers. One is cervical cancer. That's the one that's caused by the HPV virus, for which there's now a vaccine. Another risk factor for that one is smoking. Fortunately, people are more aware about both the vaccine and smoking, so prevention plays an important role. But there's also patients who haven't had the vaccine when they were younger and they've been exposed to the virus. So over time, those cells become abnormal, they become cancerous, and it can cause abnormal bleeding and painful intercourse. That's how cervix cancer usually shows up. And once we've diagnosed the cancer, radiation and chemotherapy are the main treatments. The radiation to the pelvis can have side effects because of damage to the bladder, causing more frequent urination, causing blood in the urine, and it can also cause problems with the bowel like chronic diarrhea. In fact, I have one patient, she had such bad diarrhea after her radiation treatment that she missed her granddaughter's wedding. She's like, I'm just afraid I'm going to have terrible diarrhea. And she said, and now my granddaughter won't talk to me. So clearly we need better treatments that don't cause severe side effects. And we think proton therapy may be able to help reduce these side effects for patients with GYN cancer.
Yeah, and
one of the others is endometrial cancer. That one's more common with age and being obese. Those are the two main risk factors for endometrial cancer.
Okay, well, thanks for breaking that down for us. It really seems like it's targeted right to where it needs to get to, that treatment there for proton therapy. Now, doctor, how can people find out if proton therapy is the best treatment for their cancer?
So sure, the best way is to meet with our team, to have a sit-down face-to-face consultation with a radiation oncologist. And there's a couple of ways to find us. One is online at mclaren.org/proton treatment, all one word. And the other way is our phone number, 855-MY-PROTON. That's 855-MY-PROTON. The number without the acronym is 855-697-7686.
Doctor, thank you. Is there anything else you'd like to add that we haven't talked about that you think is very important when it comes to proton therapy?
Yeah, well, sometimes it's helpful to have a visual, so I just wanted to share briefly this image from a proton therapy treatment plan, and it shows how the radiation beams come in from the sides, one from the left, one from the right, and they hit the area we need to treat, which is the lymph nodes over here on the sides of the pelvis. You can kind of see the hip socket on the left, you can see the hip socket on the right. So we need to treat these lymph nodes here in red that have cancer, but we're trying to stay off the bladder. Here in yellow, we're trying to stay off the intestines that you can see in the middle, and because that's where the side effects come from. The side effects come from treating the bladder and treating the small intestines. And if we can avoid those, then it's less likely the patient will have bladder and bowel problems down the road. And the proton beam, because it stops and it doesn't go through the middle, helps us do that.
Wow, you can really see how proton therapy works with that slide. Thank you for bringing that, doctor. We appreciate you bringing us this information today.
My pleasure. Thank you.
Of course. You're so welcome. Thank you again for watching. You can find more information in the hot link section at WNEM.com.